states aren't consistently tracking healthcare workers infected with the coronavirus. And staff shortages could be coming. As concerns mount about coronavirus infections among healthcare workers, it's unclear just how many are falling ill, and whether current hospital measures are adequately protecting them from the virus. The rest of the country has not yet seen the wave of COVID-19 cases that has upended New York's health system, and many smaller communities are likely still weeks away from peak hospitalization levels that strain their limited supplies of ventilators, face masks, shields and gowns. But in emergency rooms across the country, settings that are, by design, composed in the most dire circumstances, anxiety is settling in, even as they're assured those supplies are on the way. It's obviously great that we're getting the ventilators, but you still need respiratory therapists to manage those ventilators, and you need nurses and techs to be there to care for the patients, says Dr. James Williams, who practices at hospitals in Texas and Maryland and was formerly president of the Texas College of Emergency Physicians. Safely putting on and removing his protective equipment, a process called donning and doffing, adds an additional 15 to 20 minutes to his visits with patients, Williams says. And while Meritus Medical Center in Hagerstown, Maryland, has been forward-thinking, setting up drive-through testing and opening a clinical tent outside the hospital early on, they've already had to ration supplies. For example, Williams and other hospital staff have been putting used face masks in paper bags, sterilizing them with UV light and reusing them. The N95 mask was never designed to be reused, he says. And as supplies grow scarce, it increases the likelihood of infections among healthcare workers, potentially prompting a shortage of the very people needed to heal the ill. Reports of coronavirus infections among doctors, nurses, technicians, paramedics and other healthcare personnel have largely been anecdotal so far. An emergency room doctor presumed to have the coronavirus died in New York City this week, the first death among physicians in the U.S. The virus has also claimed the lives of several nurses, including a 64-year-old who died last week after a 4-decade career at a hospital in the nation's capital. Hundreds, if not thousands, of U.S. medical workers have contracted the virus, with their illnesses ranging from asymptomatic to severe and in some cases fatal. Yet states and federal agencies, including the Centers for Disease Control and Prevention, are not uniformly collecting and reporting that data. U.S. News contacted all 50 state health departments or COVID-19 Joint Information Centers, and heard back from 35. Of those, 10 shared how many healthcare workers had COVID-19, a total of 1,119 across those states, while 9 were not tracking those infections at all. In Pennsylvania, 4.4% of the healthcare workforce had COVID-19 as of Monday. In Oklahoma, 10.6% of confirmed coronavirus patients worked in health care. In Ohio, that share is roughly 20%. Rhode Island, roughly 70% of COVID-19 tests are going to medical personnel, and they make up a quarter of all confirmed cases in the state. Of the remaining states, it was a mixed bag. Some were just beginning to track this data and set parameters, some were preparing public reports, and some had the data but wouldn't share it. In Vermont, for example, authorities are discussing how to define healthcare workers, while in "We are taking a very targeted, strategic approach to testing," Joseph Wendelken, a Rhode Island Department of Health spokesperson, said in an email. New York State, which has more than 40% of all coronavirus deaths in the U.S., is among those that said information on how many healthcare workers have fallen ill is unavailable, and wouldn't clarify whether the state is collecting the data or not. Nearly 80,000 former healthcare workers have volunteered to work in hospitals across the state, and Gov. Andrew Cuomo this week pleaded for medical workers from elsewhere in the U.S. to join them. "Please come help us in New York now," Cuomo said Monday. "We need relief." With COVID-19 cases climbing in New York and elsewhere in the U.S., the number of infections among any group quickly becomes outdated. But tracking how many healthcare workers get the virus could be critical, as they are both in high demand and at high risk of infection. In February, one patient potentially exposed 41 healthcare workers to the virus. All 41 were sent home to quarantine for 2 weeks, according to a recent case study in the Annals of Internal Medicine. Official guidance has since changed. The CDC now says that healthcare workers who may have been exposed to the virus can continue working as long as they're not showing symptoms. It's unclear what share of coronavirus cases are asymptomatic, but earlier this week, CDC Director Dr. Robert Redfield said it could be as high as 25%. At Northwestern Memorial Hospital in Chicago, early guidance on staying home after potential exposure meant staff shortages, particularly among nurses, were a bigger problem when the outbreak began, says Dr. Seth Truger, an assistant professor of emergency medicine at Northwestern Medicine. Now, employees are screened when they arrive at work and sent home if they have symptoms. We're not keeping people away from work for just potential exposures, Truger says. Yet if COVID-19 cases do surge and put medical personnel out of work, more hospitals will be stretched thin, especially in communities that were already facing a shortage of healthcare workers and resources. For example, Idaho, New Mexico and Vermont all had fewer than 10 physicians and surgeons per 100,000 people in 2018, compared with about 5,883 per 100,000 people in New York and more than 1,200 each in Virginia and Massachusetts, according to an analysis by USA Facts. We've got an aging population, and we have 34 ventilators at our hospital, says Dr. Hamid Hosseini, an ER physician at Helen Keller Hospital in Sheffield, a city of about 9,000 in northern Alabama. That number would be significantly stressed if we had a significant outbreak. Physicians there are preparing for an outbreak in 6 to 8 weeks, Hosseini says, and his hospital has set up an entire floor for COVID-19 patients. On Wednesday, there was just one confirmed case and 14 patients were being monitored. And because more people are staying home, the ER has been so empty that the hospital has cut hours for some nurses and physicians, he says. We're expecting this to come, and we're trying to prepare the best we know how, Hosseini says. But since none of us have lived through something like this before, it's just doing the best we can, without knowing the standard so to speak.